Today class we are going to discuss one important topic in unit 2, that is infusion pump. So in this class we will be discussing right from the basic introduction of what is all about infusion pump and how does it works and what are the basic components are there, and also we will be discussing what are the different types of drug delivery systems are there in the hospital or clinical settings. Okay, let's start with the basic introduction or definition of infusion pump. So if you take any drug delivery system, for example, infusion pump or syringe pump, these are the particular medical device which is being used to deliver or infuse the fluids or drugs into the patient in precise manner or in controlled manner for over period of time. So that is the main importance of using this infusion pump. So there are certain conditions where the patients required drugs or medication for a prolonged period in very precise control manner. So in such case we have to go with this sort of device, that is infusion pump or syringe pump. This device is being designed in such a way that drugs or fluids will be delivered slowly and accurately to the patient for certain duration of time. Yes, so what are the different common routes through which we can inject or we can deliver the fluids that we are going to discuss in this slide, because there are actually four common routes are there. One is intravenous, that is usually we do when we are very tired or we have any like dehydration problems. Simply we will go to the hospital, they will put drip, right, which is nothing but one of the common routes. I mean intravenous system, that is IV system. So in IV system, here the fluid is being injected to the nerves. That is the reason the name is called IV, intravenous. So through this route, we will be injecting whatever the fluids required based on the patient condition or disease case condition, right? The second one is the subcutaneous routes. So second route is this particular route where you have to make incision to the skin, that is a deep layer skin. So that is called subcutaneous layer, into which we will be make incision, we will make direct contact with needles. From the needles the fluid will be delivered to the targeted area. That is second routes, that is the subcutaneous. Third one is epidural cases. So in epidural routes, we will be injecting the fluid or the drugs directly to the spinal cord. This is the case you can see in pregnant ladies at the time of labor pain. They used to inject this inject the fluid, that is medicine, into this area in order to give pain relief, right? So that is the one route, that is epidural. And last one is ennetal. So ennetal is nothing but through nasal cavity we will be injecting the fluids or the drugs or medications. That is the fourth routes. So these are the major four routes you can see through which the drugs will be delivered to the patient in order to have a proper patient management or post care of treatment or surgery, right? So next we will be seeing what are the parameters that is very important for infusion pump to be fixed or to be set, in the sense flow and rate. Okay, so the flow rate has to be adjusted accordingly to the patient condition. So because that is the main importance of the features of the infusion pump, because the flow rate, the whatever the rate minimum or maximum, that has to be customized in order to match the patient condition, in order to fulfill the demand of the patient disease condition. Okay, so here we have two flow rate. One is that is a minimum flow rate to be maintained, and maximum flow rate above which you should not set. So there are two flow rate, right from minimum to maximum. One is one is 0.1 ml per hour. Okay, that is the minimum level of flow rate. If you want to fix the maximum flow rate, means that is maximum you can go with 100,000 ml per hour. Beyond that, you can go with some other devices. So the infusion pump will have the flow rate minimum range to maximum range, that is 0.1 ml per hour to 1000 ml per hour. So now let's see what are the types of infusion pumps usually designed for the hospital purpose, in the sense one is open loop infusion pump, another one is closed loop infusion pump. So what could be the difference between these two, in the sense the main thing is feedback system. Okay, so if you have a feedback system, in order to control the parameter settings which is to be set in the infusion pump, then it is called a closed loop infusion pump. Whereas in open loop infusion pump there is no no feedback or real-time feedback signals to control the settings of the infusion pump. So there we have to, like physicians or the doctors, they do manual programs, or they have to set the values or flow rates, duration manually according to the patient condition. This is are the two difference between open loop infusion pump and closed loop infusion pump. Because in open loop infusion pump we are not taking any values from the sensors. Based on the values, the feedback is not be given to the machine, so that the machine will not control according to the patient demand or patient condition. Whereas in closed loop system we have a feedback control system where all the sensor information will be gathered. According to the information, this feedback control system send the signals to the input of the infusion device to customized in such a way to meet the patient demand or patient physiological signals. So these are the main difference. So where you can use open loop and closed loop, in the sense, in open loop you can use for normal routine cases, like as I told you, if you are tired, you simply go for hospital to put IV, right, to take drip. So to take the drip of saline. So in such a case, the patient is very stable and very active. Because of some problems or some tiredness, we can go with open loop infusion pump, because there is no need of feedback control. Simply whatever value, preset value we have been fixed in the infusion pump, just like that it will be given to the patient. But in closed loop infusion pump, which plays a very vital role in clinical, critical areas like ICU, CCU. In severe case of insulin therapy, in some case in anesthesia time, you can also go with a closed loop infusion pump, because this closed loop infusion pumps collecting the feedbacks of physiological signals of the patient. According to the real time physiological signals of the patient, the feedback control system will control the infusion pump accordingly to meet the needs, patient needs. So these are the basic infusion pump. You can see either open loop or closed loop. The both are available in the hospitals. So what are the other different types of that is infusion pump you can see based on the technology? In the sense, we have the two basic category. One is the gravity control pumps. Another one is positive displacement pumps. So in the gravity control pumps, we have two subdivision. That is, one is drip rate regulators. Another one is dip rate controllers. So in positive displacement pumps, again we have five setting, six different types, five to six different types. That is drip rate pumps, volumetric pumps, syringe pumps, multi-channel pumps, and ambulator pumps. So in next class, we will be discussing these different types of pumps based on technology in detail. Thank you.